Hello again, everyone, and welcome to another InsideLowell podcast, another Health Minute, sponsored by Wellpoint. I'm your host, Teddy Panos, coming to you from the Wellpoint studios here in downtown Lowell. Wellpoint is the only health plan offering benefits exclusively to Massachusetts GIC members. At Wellpoint, your whole health is their whole point. And we thank our friends at Wellpoint for making this Health Minute possible, and we thank them for making their health director available as well. Dr. Carolyn Langer is here with us in the Wellpoint studios. Welcome, Dr. Langer, on this December day, this festive time of year.
Good morning, Teddy. Great to be here.
It's good to have you here. I know this month you wanted to focus a little bit on colorectal cancer and the importance of screenings, an importance heightened by the fact that, surprising to many people, yours truly included, it is the third most common form of cancer in adults, right?
That's right, Teddy. And that really just highlights the importance of getting colorectal cancer screening at the appropriate times. Really, it's important to maintain your health and to give you peace of mind because it is a slow-growing cancer in most cases. And if it's detected early, individuals can have greater than a 90% chance of survival.
That's a very high survival rate, but it also underscores the importance of getting that screening because it's often silent, right? You don't feel anything, any symptoms. There's no visible signs, right?
That's right. So you have sometimes growths in your colon and rectum called polyps, and these can turn into cancer. They don't always turn into cancer, and this is a very slow process. And so if they are detected early, your doctor can remove them while they're still harmless and while they're easy to remove.
Who's at risk for colorectal cancer generally?
So colorectal cancer really can affect all people, regardless of age, race, ethnicity. But there are certain individuals who are at higher risk. So, for example, if you have a family history, if you have a history of inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, and of course, age, as you get older, it increases your chances of developing colorectal cancer.
There was a time everybody thought it was just something that affected men. And then Katie Couric famously did a colonoscopy live on the Today Show. And we learned, hey, ladies, you're not immune from this, right?
That's right. Right. So men and women can be affected. Again, that's why it's important for everybody to adhere to guidelines around colorectal cancer screening.
All right, let's talk about those screenings. First of all, when do you start getting them? Young, old, somewhere in between, or all of the above?
So the American Cancer Society recommends that for most people, they undergo colorectal cancer screening between the ages of 45 and 75. However, it's important to talk to your doctor because if you do have certain risk factors, such as a family history, they may want you to get screened earlier or with greater frequency.
What type of screenings are available? I'm only aware of the traditional, the colonoscopy, which I've had to do since I'm now an upper middle-aged man.
Setting a good example. So thank you for that. So there are many options for colorectal cancer screening, but they generally fall into two categories. One is the colonoscopy. And as we mentioned before, it's recommended that the average adult get screened between the ages of 45 and 75. Colonoscopy really is the gold standard, and it's the most common way of detecting and screening for colorectal cancer. So the entire screening takes just under an hour, and you typically would get a sedative to help you sleep through the procedure. And if your provider detects any polyps, they'll remove those polyps and send them for pathology, so get them analyzed. But if your colonoscopy is healthy, for most adults with no significant risk factors, they generally would repeat that colonoscopy every 10 years. The other form of screening is through these home testing kits. And there are a number of kits available on the market. Examples include Ensure One, Cologuard, and a number of other what are called fecal immunochemical tests or FIT tests. These are easier and less invasive to use. They typically come with a kit that enables you to sample the stool, mail it into a lab, and then if there is a positive finding, your provider would bring you back in for a confirmatory colonoscopy. These tests, these home tests, typically, though, do require that you administer them with greater frequency, anywhere from 1 to 5 years, depending on the type of test you use.
I did not realize that that was an option. I thought that the colonoscopy was it. The colonoscopy stuff, it's not a scary procedure. As you mentioned, they give you a sedative, you're out. I remembered absolutely nothing. The hardest part was having to do that, the drink.
Right.
But even now, they've got pills now that make it so much easier. You just pop a couple of pills and then you drink water.
Yeah, they are making the prep a lot easier to do. You still need to take that day off from work, the day of your colonoscopy, which can be difficult for some people. So those home tests can be another option, but ideally the colonoscopy really still remains our gold standard.
All right, given the fact it's a simple test and a pretty simple procedure, if they do find any of these polyps, no excuse for any person, male or female, to not follow these guidelines and follow your advice.
Yeah. And, the other thing I want to highlight, despite the fact that there are many risk factors that are out of your control, there are still many things that you do control, such as exercising regularly, maintaining a healthy body weight, a good diet that includes lots of vegetables, fruits, whole grains, drinking alcohol in moderation or not drinking at all, quitting smoking.
That last segment right there, we can probably snip it and use it for every single bit of health advice, right? Because so much of people's health is affected by those things that you just mentioned now.
No, it really is a good recipe just to approach every condition. Lifestyle is still one of the most significant factors that you can adhere to in terms of controlling your risk for a range of chronic diseases.
All right. Great information as always. Dr. Carolyn Langer, thank you so much for joining us. Have yourself a wonderful holiday season. Happy New Year to you. And we'll see you in January. Hopefully we can avoid the snow around your next visit. Okay.
That's right. Happy, healthy New Year.
All right. Thank you to
Thank
Dr.
you.
Langer. And thank you to you as well for joining us. Hoping you learned a little bit something there about the importance of getting your colorectal screenings when advised. Again, it's not that difficult, but it can be deadly if not followed properly. So thanks to everyone for joining us. Till next month, everybody stay safe and please stay healthy.